I can't even begin to say how crucial this update is. For Europeans, particularly UK and Ireland, now that we're proceeding to impact our society in horrific ways with full lockdowns again, in an endemic phase of the SARS-CoV-2 virus, with the epidemic long behind us. So let's go. Quick check with the World Health Organization 2019 guidelines, October-November 19, for epidemic and pandemic situations. Social distancing measures segment. Contact tracing is not recommended, not recommended. Very limited data on efficacy, and after a virus has largely entered a society, efficacy very low. Quarantine of exposed individuals, not recommended, not recommended, right? Feasibility, low quality of evidence for efficacy, right? Not recommended. And of course, locking down healthy people across whole society, they didn't even cover, because that's too absurd to really document. We now have many publications, including Lancet, that show clearly, based on the data, that lockdown barely or does not affect deaths per million outcomes. So, no excuses anymore. She shows Sweden here and Ireland. Pretty much a similar outcome if you account for demographics, but Sweden didn't lock down, no masks. Ireland did the whole thing. Right? And now Sweden is doing nearly the best in Europe at the moment in terms of deaths per million. Here's Sweden, CNN team in the epidemic itself. And these photos were taken by a video crew, people getting their hair cut, even elderly, schools up to 16 years old, all open, playing, no masks, cafes, etc. Doing the 2019 WHO pandemic guidelines stuff. Sweden now for the last few months, how are things? Well, here's some photos. So, no masks, and pretty much back almost to normal, and the best performers in Europe at the moment for the endemic phase coming into the winter. Public transport, no masks, nothing. And the published analyses now demonstrate that lockdown achieves little impact on mortality and the real metrics, so Sweden, when accounting for demographic and other factors, performed essentially the same as Ireland. Now, that's a fact. Just to put things in context, here's the last 100 plus years of mortality per month, excess mortality. You can see here the Spanish flu spike. That was a genuine once-in-a-century epidemic. And let's look at the corona spike in Sweden. Well, here it is, bottom right. And as you can see, nothing untoward, really. And Sweden this year, in excess all-cause mortality, will not show up at all, especially given it followed a very soft 2019 Sweden, which would have left a lot of susceptible people for 2020, but they still are not going to show up in any signal in all-cause mortality. I'm going to switch back to Ireland now, 2018 data, and you can see here from around 8th of September, coming into the winter, you get an enormous rise in respiratory virus identified hospitalizations, a 7 times increase. Right? And your beds do fill up. We know this. I'm just superimposing Ireland hospitalizations with SARS-CoV-2, positive PCR, and as you can see, there was no real signal emerging at all versus prior years when they'd actually made the decision to lock down the whole country. So that's interesting. It was based on modelling which came from Imperial, which already is proven to be out by a factor of 10 to 12 in general from the epidemic modelling back in February, March. Just going to show hospitalisation per day for Ireland, admit and discharge, and ICU down here. Yellow or orange shows coming in, green going out. So this is since 1st of October, and really no untoward signal was there before the full level 5 lockdown on October 21st, 22nd was forced in. Showing the positive rate, percentage positives over the previous 7 days. It's done a bizarre thing. October 17th, it curled over rapidly and fell rapidly. Very unusual pattern. But the level 5 full country lockdown would only impact this curve around here, right? So the level 5 lockdown of Ireland is mathematically now illustrated or demonstrated to be pointless. So all of the negative impact on economy, massive job losses and countless suffering and deaths that will accrue due to it, technically meaningless. Here's confirmed cases in hospital, latest data. You can see 21st October, it flattened off quite suddenly. And the level 5 terrible lockdown of the whole of Ireland, the impact would only really affect hospitalisations out here. And as you can see, no impact on the curve. So unnecessary. ICU, again we see 29th of October, a flattening. But to be honest, the rise was not huge in any case. Only 40 people in ICU out of 5 million people in the country. So 8 people in ICU with a positive PCR per million people in the country. But 29th October, it kind of stalls. And the lockdown level 5 that was put in Ireland, right, with its enormous negative impacts, unconscionable, the effect of that would only come in somewhere here. So again, mathematically, essentially proven to be unnecessary and irrelevant, except for the huge damage it will cause. So Panda Analytics, I recommend pandata.org for excellent analytics. And we can pull this out, the cases for Ireland, 7-day rolling average, and 20th of October, it curls over sharply. Again, the level 5 lockdown put in, the impact would start here at best. So no impact on the trajectory. And looking at the R, everyone likes the R number, 16th of October, it maxed at 1.3 approx, and then curled over and came down sharply. For this, the lockdown, level 5, shutting down the whole country, the effect of that would impact somewhere around here. Again, mathematically shown to be unnecessary completely. In fact, the rate of fall slowed down after the lockdown level 5 went in. Going to show now something really interesting that we've touched on. United Kingdom, Spain seem to be going through a kind of endemic winter resurgence, curl over at the moment. Most countries look like this in Europe. But Ireland looks different. It looks kind of weird. This is what it looks like. What's going on here? So again, the level 5 country damaging, economy and public health damaging full lockdown would only affect this curve here. And again, we see it's irrelevant. But did anything happen around the 8th of October? Well, interestingly, a paper came out from the Health Authority in Ireland, and it basically said that, guys, we're doing too many cycles in our tests, and we really should look at doing fewer cycles, because over 30 or so, there isn't viable virus that you can cultivate in a petri dish. And they went through a lot of stuff that we've been talking about for many months. The PCR were over testing and will have false positives aplenty. So that paper came out October 8th. So there may be a connection, perhaps, if strategy shifted somewhat in Ireland and moved to a more reasonable PCR strategy in interpreting results. But we don't know that. So, quick look at the actual epidemic in Ireland for the record. So here's the deaths per million. It's back in April, it peaked. But note that 95% of the deaths were never given ICU. That's 19 out of 20. The reason was they were so aged or already ill or close to the door, sadly, it was inappropriate to put them through the process of trying to save them, independent of their COVID-19 status. So that's perspective. If we limit the actual epidemic to the others, the 5% who are not so aged and ill that they would not be given ICU anyway, we see this. So the peak of the actual SARS-CoV-2 epidemic in Ireland, around 0.5 person per million people per day passed. And then after that, obviously, it's flatline, pretty much. Vast majority of Ireland's deaths were already so aged or ill they didn't receive ICU, independent of COVID. And again, we got to remind ourselves that this wasn't better because of the lockdown we did, because we have so much science now and published analyses that show that lockdown barely, if any, real impact on deaths per million. So, no excuses there. Here's Ireland's all-cause mortality. You can see 2020 no different than prior years in overall excess mortality for the first 5 months of the year where the actual epidemic happened. 2019 was soft January, so this should have been worse. But still, April is not really different than January of 2017 and 18. So no difference. No impact on overall mortality from the COVID epidemic. And remember, it wasn't blunted by the lockdown worth anything, because we have all the science published on the data now, not modelling, actual data. Euromomo shows all-cause mortality. It's crucial. Here's Europe right up to date as of 11th of November. And you can see the spike in mortality in the 65 plus back in around March, April in Europe. And it took advantage, sadly, of an extremely soft with no excess mortality season in 20 up to March, and 19 also extremely soft season. So multiple published papers now that the soft prior seasons are a huge driver of the size of the mortality spike when SARS-CoV-2 hits, seasonally triggers. So that's an explanation for quite a lot of this. But you'll notice now in the latest weeks, and there may be a little lag, there is a rise a little for Europe above baseline, but we're heading into the winter season and SARS-CoV-2 is now endemic and will do its thing, sadly. But let's look at the excess all-cause mortality for the whole of 2021 winter, and I would say the chances of it being higher or inordinately high compared to prior seasons like 2018 are vanishingly low from the science. Ireland, we see the hump there in April that occurred, right, from SARS-CoV-2 pretty much. But we notice low overall mortality ever since, and the trend in recent months, right, for all the hysteria, the trend being below baseline. So Ireland is going to end up with 2020 as a very relatively low excess mortality year, it would look like. That's the reality. Ireland and Sweden again, to polish off. Just going to show that a real epidemic has a rapid near vertical rise in ICU and mortality, and hysteria has a near horizontal as you head into endemic virus winter. So SARS-CoV-2 is claiming a lot of the respiratory mortality that is occurring, and that's pretty normal because we know that SARS-CoV-2 in the virus kind of environment, the influenzas have receded and kind of been kicked out. And we've published science on this in past decades where some viruses disappear their activity when a new virus or dominant one comes in. So again, hysteria is near horizontal. Note it being different than an actual new virus epidemic. A new virus only gets one big shot at a naive population. England is a great proxy for Ireland because it's got better data on all-cause mortality. So we're going to look at England, which is affected more than Ireland, as a proxy for Ireland. Just note here, 2018, right? All those newspaper articles about the crisis, the killer flu, hospitals were overwhelmed, no lockdown, no masks, no hysteria, but it was a huge issue. So that was 2018. We have short memories indeed. Look at the difference with how we approach a similar scenario in 2020. Here's the hospitals in Britain a couple of weeks ago, and yeah, some of them are up to 27% of patients with SARS-CoV-2 positive PCR, not necessarily driven by COVID. So there's some hospitals, but look at the vast majority are below 10%. And I'm going to show the second half of the hospitals now. And these are all down around 2% with a positive PCR, right? So you can see the enormity that across the hospital system, SARS-CoV-2 positives are a tiny proportion, really. And again, we got to stress that if people break an ankle or go in and get a positive test, they're a COVID hospitalization. That's a reality. So you can add that to this data. We're going to look now at ICU loading in the UK, which is affected far more than Ireland. And here's the epidemic itself, and here's now the winter resurgence, right? But remember, these are ICU with positive PCR, and everything's getting tested now. So these are not comparable, really. But note how the ICU has flattened off in any case. So like Ireland, the curve is turning before they do the draconian lockdowns. So same story. Here's all-cause mortality, and pulled a few weeks ago on 16th of October. It was heading for being normal trajectory for January of 21, if we compare back to last year. Then when the data was pulled on the 23rd of October, it was again heading on trajectory. And the data pulled 30th October, the latest, still on trajectory, right, for start of 2021 for all-cause mortality. Right? So that's the reality beyond the hysteria. Very interesting data from Public Health England here. You'll note that the excess deaths are not occurring in the hospital setting. So it can't be COVID really. In fact, hospital setting has negative death rates compared to expected or prior years. Fewer deaths. So deaths not occurring in hospital. Deaths not occurring in care homes, nursing or residential. Interesting, because that's where you'd expect genuine COVID-driven deaths to occur. So where are they occurring? Well, they're occurring in the home, in own home. That's where the excess mortality is after the epidemic passed months ago. That's where it's occurring. And again, you cannot suggest that COVID-19 is not killing people in the hospital where they'll all end up, clearly, but is actually killing people in the home. We're also getting excess death in other places in England. So this will include, I'm sure, suicides, etc. So these home deaths and other places deaths are lockdown-induced deaths, most likely. Right? Certainly not COVID. That makes no sense. Just showing now, what are they dying of, these people at home and other? They're dying of heart disease, heart attacks. They're dying of all other causes, right? Not COVID-19. They're dying of strokes, right? Not COVID-19. They're dying of liver diseases and cirrhosis, right? So you might guess why that might be the case. Not COVID-19. And we see that where the excess death is occurring, around 20% over normal, rough and tough, it's in the younger ages, 15 to 44 and 45 to 64. They're not the COVID-19 ages. And in the elderly, here's 85 plus, there's no excess death. That's the COVID-19 population, as you well know. So, combined with the fact that deaths are at home and in other places, and not in hospitals, and that they're in a younger cohort, including, shockingly, 15 to 44-year-olds, we can conclude that COVID-19 is not leaving a mark at all, but lockdown is leaving a mark, indeed. So white screen now and think about what you've just seen. What on earth are we implementing draconian lockdowns for? After the curve has turned down itself, destroying our economy and driving further blood on our hands with lockdown-induced deaths being made even bigger long into the future. Why are we doing this? It makes no scientific sense.